Len, good to see you again this morning. There's been a lot of talk about a drug combination that some people are saying is very hopeful. You've looked at the studies. What'd you find?
David, I found the evidence is actually pretty thin. There's some reports in the Chinese literature. There's some observational comments that the chloroquine type of drugs may have made a difference, and it appears from what was written that perhaps the Chinese have incorporated that into their treatment regimen. There's a study from France that was basically a very small observational study. A number of patients that were supposed to go in the study were excluded for a variety of reasons, including their disease getting worse. It measured viral load, how much virus is in the body. It didn't tell us anything about whether it really made a difference in the outcome for patients. We need controlled trials, and that's an important piece of evidence that would help us understand better whether these drugs really work or whether they don't.
So particularly for cancer patients who really want to protect themselves, if they're considering this, or if they have a family member who knows that their friends are considering it, what would you tell them today?
Well, I would tell them to be very, very cautious. We don't know what the harms could be for cancer patients or for any patient for that matter. The reality is, in cancer care for decades, we have had stories about drugs that are miracle drugs. They're going to work. They're going to cure the disease. They have no side effects. And let me share it with you in my experience. More often than not, that's not the case. Sometimes these things do work. Many more times they don't. So we need to be realistic. Clinical trials, get the evidence before we start saying that these are game-changing medications.
And those trials are underway.
They're starting as we speak.
Len, thanks for your time today.
Thank you.